to assess them by a scale of 10. In this mass school, he has scored a poor 2/10.
That's according to your.
That is they've given the assessment. It is according to me. For them, if you've not given me 10 to 20%.
Until September, we'll do another scorecard with the smart schools, and let's see what percentage are actually ready to run. This program will not be a success if we do not look at the health sector for these past 2 years, because health is wealth. So, what's your assessment? 260 Type 2 primary health centers in the state. We have an international hospital ongoing.
In 2023, when this government started, he inherited 566 primary health care centers in 17 local government areas of Enugu State. 47% of them are in state of disrepair, collapsed. They are not functioning, very dysfunctional. And I think the reasonable thing he will have done will have been revamping them, staffing them, equipping them. But they are still abandoned as we speak. And he started 260 projects that we don't understand their status across the 260 world. You see, he has a very high interest in trying to move Enugu State forward, but unfortunately for him, he's a very poor project manager. They don't do thorough assessments of what is happening. And as it stands now, Enugu health situation is in comatose. Parkland, for instance, walk into Parkland healthy, come out from Parkland sick because of obvious challenges in Parkland. Staffing, equipping them, providing necessary things for them. What he will have still done is doing 17 general hospitals across board. Local government chairmen that have been receiving between 400 million, 500 million every month will have done the primary health care facilities in their wards. It becomes the responsibility of the local government to completely execute that one. But unfortunately, what we have is flying the completion of a project, hospital project at Rangers Avenue, that Chimaro Kobunian Namani started, that successive PDP government refused to complete. Sullivan saw it, abandoned it. Buruburu did not do anything 16 years, and Peter Obi is doing it. And people say he really tried by doing it. Why wouldn't he try by doing it?
Why would he try doing it?
The man that brought him into governance. You see, you keep on telling you that he's not a politician. Chimaro Kendamani is his boss. His boss made him Commissioner of Finance when he was a governor. His boss, Chimaro Kendamani, made him Chief of Staff. He's making the Enugu to feel that he does not have a boss. I can tell you clearly that his boss drafted him to become the governor of Enugu State when he floated a banner for Buruburu, which was used as a platform, political rapprochement to convince Buruburu to support him when Buruburu was dilly-dallying.
Does that have anything to do with the international hospital being built by?
Exactly. You are boss. You must try to do some things. His boss, Chimaroke is his boss. His boss built it, and he was Commissioner of Finance that signed out some money for the construction of that project. And he saw some letters when he was Chief of Staff towards that same project. And what he's doing, yes, he did well, but he should try and be giving kudos that I'm completing a project started by a previous government. Because as of now, he does not have any project he said he has started from the scratch. So we'll give him 50% kudos of doing that, for doing that, and 50% kudos for the man who conceptualized the idea 25 years ago.
But was not completed.
Yes, now it's a continuity. PDP government does not. You see, the problem with PDP is that each administration that comes try to start a project afresh. That's why I'm giving you kudos. And the kudos I'm giving is that because it's coming from the tributary of a boss that brought him into this game.
But that project will not be for Chimaroke. It will be for Enugu.
Chimaroke never built it for himself.
It's an international hospital.
Exactly.
That's going to serve even the entire country.
Exactly. Chimaroke conceptualized it and he's completed it. I say I gave him kudos for that. But in the whole infrastructural hemisphere of Enugu State, he's scoring very low. Polyclinic has been there since I was a kid in this town. The population of that area has expanded beyond, and it's still the same polyclinic. What kind of developmental planning do we do?
We learned the last administration under Burburu upgraded polyclinic.
Burburu upgraded polyclinic. And I'm telling you that the population between when it was upgraded and now is almost 7 years. If you understand hospital facility management, you know it is a steady thing. Health is wealth. That is why you have proliferation of private clinics milking the Enugu of their hard-earned resources because the public facilities that were provided those services are wanting. And it requires, that's why when Oliko Erason Kuti was the Minister of Health in the government of President Ibrahim Badamasi Babangida, he focused on primary health care center. Before you come to a tertiary facility, that is a critical issue. Things like malaria, typhoid should not take you to Park Lane.
Isn't that why the current administration is building these 260 smart type 2 primary health centers at the world level?
They are building. I'm telling you, 566 are in comatose. So we'll be waiting for when it is completed before we get health attention. That means we'll be dying. As it's still being built, those selling coffin will be making business.
No, they didn't close the 566.
I am telling you that I'm telling you 47% of them are not functioning. The ones that are, in fact, the ones that are fully functioning, since you want statistics, is around 12%. Fully functioning as a primary health care center. You can do your research.
Out of the 566.
I say you can do your research. It is my word against your own. Do your research and do your finding. I want to be a little bit courteous, but you want me to give you the full. So what is functioning is 12%.
All right, let's talk about water in Enugu State. I mean, one of the major things that he promised Enugu was providing water from when he started to at least 180 days, you know. But he has also come up to say that there are challenges. He has acknowledged that there are challenges, and they are building on some of the things that they have done, changing the pipes, you know, and also doing reticulation to people's homes, as the case may be. So one would look at that and say, well, at least for the meantime, we are seeing some development in that direction. What, you know, past administration have refused to do.
Water problem in Enugu is very intractable. It's been there for the past 25 years. The problem of water in Enugu is not a problem of science. Neither is it a problem of engineering. It's a problem of not having the will to run it. Chimaroke Nnamani, when he became a governor, tried by trying to solve Enugu water problem, but he couldn't. The one fundamental thing he did was getting the federal government through CGCC to do a heavy revamping at Oji River waterhead. Olusegun Obasanjo came to Enugu and commissioned that project at the twilight of his administration. There came in Sullivan Chi. It was not solved. Sullivan Chi came in, tried his best to revamp the Enugu water project, both Oji River and actually water works. A lot of money was frittered away in Enugu water project because then you could see pipeline being laid everywhere. But unfortunately, again, some things happened in his government and we did not have any water. Burburu came in.